So in this video we're going to discuss the different ante and postnatal tests that are carried out to ensure the health of a pregnant mother and her baby. So firstly, we need to know exactly why antenatal screening is carried out. We need to know a little bit about ultrasound imaging and when during the pregnancy it's carried out and why. Okay, so let's have a look at ultrasound imaging. So an ultrasound image is a routine part of antenatal care, and it involves using sound waves to generate an image of the fetus as it's growing in the uterus. You can click on the two links below and you can have a look at the process that's involved in getting an ultrasound image. So during pregnancy, a pregnant mother will be offered two opportunities to go for an ultrasound scan. The first one is called the dating scan, and the second one is called the anomaly scan. So the dating scan is usually carried out between 8 and 14 weeks, although normally it's carried out around 12 weeks. You can see from the pictures that there is a big difference in what can be seen between an 8-week scan and a 12-week scan. The purpose of the dating scan is to give information about the stage of the pregnancy and the due date. Dating scans are often used alongside tests, particularly blood tests, to test for marker chemicals which normally vary in the blood of the mother during pregnancy. These are substances that are present in the mother's blood or urine, and the different levels of them can indicate or not whether the baby is affected by certain medical conditions. So they will take a blood sample or a urine sample and screen for any substances that could indicate that there is a problem. So if a particular chemical is particularly high or particularly low, that could indicate that there's a problem with the fetus. The anomaly scan is usually carried out between 18 to 20 weeks of pregnancy, and its purpose is to detect any serious physical abnormalities in the fetus. So things like cleft lip and palate, where the two halves of the face haven't joined together properly, or heart defects, or kidney defects, or a condition called spina bifida. These can all be detected by the anomaly scan. And if you want to, you can go to the PowerPoint and read a little bit more in detail about them. However, the details of this are not required for the course. So, during pregnancy, biochemical tests are also carried out. Okay, and these are routine blood and urine tests that monitor the concentration of particular marker chemicals. So, during pregnancy, there will be regular midwife visits. These will be to carry out general health checks on the mother. Each time she goes, they will check her blood pressure, there will be urine tests, and there will also be blood tests. And these are performed to make sure that her body is coping with the pregnancy. Biochemical tests that are carried out will detect the concentration of key marker chemicals which are produced during pregnancy. This can be used to detect particular medical conditions in the fetus. These chemicals do not give a precise yes or no answer as to whether the fetus has a condition or not. However, they're taken along with other things like maternal age, and they are able to assess the risk of the fetus having a particular condition. And then the mother could be offered additional tests that would give a definitive answer, yes or no. Because these tests test for the concentrations of these specific marker chemicals, it's really important that they are carried out at the correct time in pregnancy, because measuring the chemical at the wrong time could lead to a false positive result, and that of course could cause huge amounts of worry and anxiety for the parents. So a false positive would be an example that if a particular test designed to detect Down syndrome gave a positive result, but the fetus did not have Down syndrome. So abnormal concentrations of these chemicals can then lead to diagnostic testing to determine whether the fetus has a medical condition. So like I said, these biochemical tests themselves do not tell you definitively whether the fetus has a condition or not. They are just screening tests to assess the risk, and then if the risk for a particular condition comes back high, then the parents would be offered additional tests. And these additional tests could be something like an amniocentesis or a chorionic villus sampling, which we will come back to in a moment. Okay, so this section then is going to describe amniocentesis and chorionic villus sampling. So we need to know a brief description of each process. We need to know the information that can be obtained from each process, and we need to be able to give details of the advantages and disadvantages of each process. We also need to know what amniocentesis and chorionic villus sampling can give us information about. So, if the risk of a particular condition has come back as high as a result of one of the routine screening tests, then further diagnostic tests are offered. And these would be something like an amniocentesis or chorionic villus sampling. So when the parents decide whether or not to proceed with these tests, the risks must be considered along with any potential side effects of the tests and any decisions that they may have to make if the test is positive. So this is just a wee recap of a karyotype. If you remember, we talked about karyotypes when we were doing mutations back in Unit 1. A karyotype is a visual display or a picture of an individual's chromosomes, and they are arranged in homologous pairs. From the biggest pair, chromosome pair 1, down to the smallest pair, pair 22, and then the sex chromosomes, either an XY, as in this karyotype, or XX for a female. Okay. So the homologous chromosomes are arranged into pairs because they will be the same length, they will have the same genes at the same position, and they will have the same centromere locations. So that allows us to arrange them into pairs. So for all the homologous chromosomes may have the same genes at the same positions, those genes may contain different alleles. So, for example, if it's the gene for eye colour, one chromosome may carry the gene for brown eyes, and one chromosome may carry the gene for blue eyes. So, an amniocentesis is a diagnostic test that is carried out during pregnancy. It can be used to generate a karyotype, and that can then be used to determine whether the fetus has got a chromosomal abnormality. Things that might increase the risk of an abnormality would be the mother's age. So the older the mother is, the more likely it is that the fetus will have a chromosomal abnormality. The mother's medical history, and if there is any family history of inherited genetic conditions. So an amniocentesis would be performed between 15 and 20 weeks of pregnancy. The procedure involves removing a sample of amniotic fluid, which contains fetal cells, and then analysing that. It can take about 2 weeks to produce a karyotype from an amniocentesis, because the fetal cells that are obtained need to be cultured in the lab. This means that if the result does return that the fetus has got a serious genetic abnormality, and that means that the parents may wish to proceed with a termination, that means that those decisions have to be taken very quickly. So this diagram shows the procedure for an amniocentesis. So it's carried out under ultrasound, and a needle is inserted through the abdomen into the amniotic sac, to withdraw a sample of the amniotic fluid. If you click on the link down in the bottom left hand corner, you will be able to watch a clip showing an amniocentesis. Okay, so this shows a little bit more detail. So the doctor will use the ultrasound to guide the insertion of a needle through the abdominal wall into the amniotic sac. A small amount of the amniotic fluid is withdrawn through the syringe. That sample is then centrifuged, which means it's spun round at very, very high speed. That causes all of the fetal cells to sink to the bottom. The fetal cells are then separated from the amniotic fluid and they are then cultured till there's a significant number of them. And then tests can then be formed on the cultured cells. They can undergo DNA analysis to produce a karyotype for chromosomal analysis, and chemical analysis can also be carried out. So, chorionic villus sampling also involves getting a sample of the fetus's DNA. This can be performed slightly earlier in pregnancy at 11 to 14 weeks. And it means that a sample of the chorionic villi, the fetus side of the placenta, is removed for testing. And this can be taken through the cervix or the abdominal wall. The karyotype for this can then be produced after a few hours, rather than the few weeks it takes to produce a karyotype from amniocentesis. However, the downside to this is that chorionic villus sampling has a higher risk of miscarriage than amniocentesis does. And again, you can click on the link at the bottom to watch a video about chorionic villus sampling. Okay, so again, here's a diagram showing the procedure. Ultrasound is once again used. Right? A catheter can be inserted up through the vagina, through the cervix, into the uterus to take a sample from the fetus's part of the placenta. Okay, so you can see from the diagram here the chorionic villi are these little sort of tree-shaped blood vessels, and those are the fetus's side of the placenta, so that will contain a high concentration of fetal cells, which takes out the cell culture stage, which is what makes chorionic villus sampling much quicker than amniocentesis. Okay, so this slide shows a comparison between the procedures of amniocentesis and chorionic villus sampling. Okay, and you can see the main difference between them is the time taken to generate the karyotype. Several weeks for amniocentesis, but several hours for chorionic villus sampling. So this final slide here just summarises the pros and cons of chorionic villus sampling and amniocentesis. Right. Pros for CVS are that it can be carried out earlier in pregnancy than amniocentesis, and the results are ready much more quickly. However, CVS is less accurate than amniocentesis, and it also carries a higher risk of miscarriage than amniocentesis. Now, if you want to go on in the PowerPoint that's been posted on Show My Homework, then you can. There are additional details of some of the genetic disorders that can be screened for using amniocentesis and chorionic villus sampling. These are not required for the course, but you might like to read about them just for additional information.